Welcome back to Medically Speaking. In this episode, we'll be discussing why choosing a primary care physician is one of the most important decisions you can make and why those yearly visits matter more than you think. I'm joined by Dr. Carly Fowler. She's an internal medicine physician and a PCP at Wilmington Health, and she provides personalized and comprehensive health care to adults of all ages. Carly, why is it so important when choosing a primary care physician, and why do those yearly visits matter more than we think?
So choosing a primary care provider is often your first point of contact with the healthcare system. Whether you're seeing your PCP for an acute visit or you end up needing a referral to a specialist, it's very important to have someone that can serve as your quarterback, essentially, in your care. And then the annual visits are very important because it's a time for us to review your overall health, your social history, surgical history, which medications you take, and we can also find ways to catch diseases early before you may develop symptoms.
What types of things do you do at these annual visits?
Yes, so at annual physical exams, we assess the whole body, we do a thorough review of symptoms, we discuss medications, we discuss cancer screenings, vaccinations, and we also help create goals for the year. So we help patients achieve different changes in their lifestyle, and it's just a very important time to review your overall health. We also discuss family history, which can help guide further testing that may need to be performed. And so overall, it's very important to see your doctor every year so they can keep an eye on trends of your health.
Well, a lot of people put these visits off because they feel healthy and they don't think they need them. What would you say to someone who thinks that they really don't need a PCP?
I often hear this, and I would say that being healthy starts with prevention. So staying on top of your health every year, getting your annual blood work done, an annual exam is very important. Often chronic diseases present with signs and symptoms that patients don't always notice themselves to start. So your primary care provider can start to pick up on these signs early and help prevent them from progressing further.
When someone is looking for a primary care physician, what are some things that they should be looking for?
So my first recommendation is for patients to feel comfortable. This is a very important relationship that you ideally maintain for many years. Primary care is intended to be longitudinal. And so I would say comfort is important. I also think it's very important to learn how your primary care provider manages chronic illnesses and also understanding their access to care in case you were to get sick and need an acute visit. It's also important to understand that they are able to see you for that as well.
Well, what would you say as a doctor to someone listening right now or watching this that might not have a PCP and need some encouragement to take that first step?
Absolutely. So I would say it's important to review where various physicians who have new patient availability have trained and maybe their hobbies and interests, and see if it's someone you think you might connect with. And then it's important to call to make that first appointment. I always tell people that the first step is the hardest, which is making the appointment. And from there, usually things go very well.
Well, thank you so much, Dr. Fowler. Choosing a primary care physician is one of the most important decisions you can make, and those annual visits matter more than you think. For more information, you can visit wilmingtonhealth.com. We'll see you next time.